Today I want to talk to you about memory, Alzheimer disease, and how you can reduce your risk of Alzheimer disease later in life. Do you worry about losing your keys and then think, could this be the early signs of Alzheimer disease? If you think that way, you're not alone. Millions of Americans have the same concerns. It turns out that what we call Alzheimer disease is really not one pure condition. It's usually a mix of different things that cause brain shrinkage throughout life and then make a person forgetful to the point that they may not even recognize family members. In fact, there was an article about this whole issue on a Tuesday issue of the New York Times this week. It talks about how you may have a diagnosis of Alzheimer's disease, but you really just don't have Alzheimer's in your brain. You have a lot of different things. Let me explain to you how these things work. Well, there are two parts of the brain that are really important for memory. The part of the brain that's important for short-term memory is called hippocampus. It's roughly the size of your thumb. You have one on the right, one on the left. Without this part of the brain, you can't memorize new names, new information, or anything. And then we have cortex, which is the outer layer of the brain, and this is the part of the brain that's important for long-term memory. It is also important for your higher cognitive abilities, such as doing your taxes, driving, or trying to win a conversation with your spouse or coworkers. Okay? So what happens with aging is that this hippocampus, and to a lesser degree this cortex, shrink. They shrink a lot. Actually, after age 50, they shrink by about 0.5% per year. That's a lot of shrinkage. Now, what's causing this shrinkage? Is it just Alzheimer's? The answer is no. Alzheimer's is a disease in which pieces of peptides and proteins clump up. They aggregate into insoluble little pellets, and they attract inflammation, and by doing so, damage the brain. So Alzheimer's is a disease that we think will still remain a mystery. What's causing Alzheimer's? But the recent discoveries in the past 2 years are telling us that our lifestyle factors may have to do with how much of this Alzheimer's protein we have in our brain, and the fact that there are other things that cause shrinkage in our brain. Let me explain. Let's say you only sleep 3 or 4 hours a night. Could that be contributing to your Alzheimer's disease? Yes. Studies have shown that when people don't have enough sleep, they have more Alzheimer's proteins called amyloid and tau in their brain. Just think of it. Your lack of sleep causes your Alzheimer's disease. Now, if somebody has obesity or they have vascular risk factors such as diabetes, hypertension, those can also cause shrinkage in the cortex and hippocampus. People who have anxiety and depression have more brain shrinkage, especially in cortex and hippocampus, than those who don't. Concussion patients have a lot more shrinkage in their brain than those who don't have concussions. So it turns out that throughout life, your lifestyle factors determine whether or not your brain stays healthy and strong, or if it shrinks and shrinks and shrinks. So what you do today really makes a difference on how healthy your brain will be in the future. Your brain is a lot like your teeth. If you take care of it, it will be healthier and stronger. If you don't take care of it, it would decay. In our next episode of our conversations, I'm going to tell you about 6 interventions that are extremely helpful for you to reverse this brain shrinkage that happens with aging. But until then, please stop worrying about Alzheimer's. The more you worry about it, the more your brain will shrink.